Aslam. I'm a consultant orthopaedic surgeon specialising in sports injuries and robotic surgery here at Spire South Bank Hospital in Worcester. With the Six Nations round the corner, we here at Spire Healthcare are keen to give you some tips so you can pick up a rugby ball yourself and avoid some injuries. Tip 1. Regular conditioning and fitness training. It's really important to get the muscles strong, work on flexibility, strength and endurance. We need to work on the muscle groups which get injured, such as like the hamstrings, the knee and around the ankle. Tip 2. Techniques and safe play. It's really important to get the techniques right, both in terms of tackling, scrummaging and rucking. Safe play avoids injuries. It's important to protect yourself with mouth guards and knee supports, which is out there. Tip 3. Adequate rest and recovery. Fatigue increases the risk of muscle injury. It's really important that you get good techniques to warm up and cool down and rest those muscles between the games. Tip 4. If you're unlucky enough to get an injury, start straight away with RICE, which is rest, ice, compression and elevation. We get the swelling down and start working on the injury straight away. Tip 5. Specialist care and rehabilitation. Some of these injuries are going to require assessment by an orthopaedic consultant, get the diagnosis and imaging right. Then we can get you a specific specialist physiotherapy program so we can rehab you back to fitness and avoid any further re-injury. Those are my top 5 tips to avoid injury and get you back playing rugby. If you need any further information, search Nadim Aslam at Spire South Bank Hospital, Worcester and get ready to play.